Hi, today my partners, Elliot and Abby, and I, Bridget, will be talking about steroids and teens. The lenses that we used to research our question were scientific, social, cultural, and futuristic. Our investigative question is how are teenagers affected by steroids? We have come to the conclusion that teens should not use steroids unless they are prescribed by a doctor or medical professional. Now I will discuss the scientific lens. Anabolic androgenic steroids are drugs that increase certain levels of hormones in the body and increase strength in muscle. They bind to cells and damage vital functions in the body that the body needs to operate properly. Peter Bond and his partners work with the Department of Internal Medicine in the Netherlands. He states that anabolic androgenic steroids are the most commonly abused within society and that they are absorbed into the circulation after intramuscular injection or oral ingestion, transported to the tissue, diffused into cells, and bind to receptors. These forms of taking anabolic steroids are the most prevalent among users. According to Sarah Goldberg, licensed psychologist, when steroids are used in combination with exercise, training, and high-protein diets, they can increase size of muscle, endurance, and decrease recovery time in between workouts. Athletes and young boys are looking for these effects, but ignore the intense side effects on the body. Physical, mental, and cellular changes occur when using steroids. When young teens use anabolic steroids, their growing bodies are stunted. Kyle Ganson with the School of Social Work at Simmons University states that anabolic steroid use is associated with negative biological, psychological, and social side effects, including substance abuse and suicidal and violent behavior. Not only do effects like acne, hypertension, erectile dysfunction, and more negatively change the body, but also can increase more insecurity about the body, leading to more substance abuse. Zhang Wenbo and Zhang Yang with the Department of Physical Education discuss when using AAS of anabolic androgenic steroids, cellular complications arise when activation of signaling proteins leads to alteration in protein synthesis pathways, cell cycle, and oxidative stress. These effects will permanently impair crucial functions that the body needs to operate and can lead teen users to experience issues in the future. Now to discuss the social cultural lens is Elliot Schultz.
According to Grober, steroid use is predominantly among boys, with 1.2, 1.8, and 2.6 for 8th, 10th, and 12th graders, and 0.9, 0.7, and 0.4% for girls. Additionally, according to NIDA Director Dr. Alan Leschner, steroid use has increased 50% in 8th and 10th graders since 1991. Goldfield states adolescence is a vulnerable time to develop body image issues, eating disorders, and mental illnesses, and youth are spending on average 6 to 8 hours per week on screens, which is primarily on social media. Exposure to social media can lead to an internalization of unrealistic beauty standards that are unattainable, resulting in a greater dissatisfaction with their bodies. A negative outlook on one's body can also result from constantly seeing an up-close, distorted image of their face through an iPhone lens or through the mirror. Adolescents then think that a quick way to solve their problems is by taking anabolic steroids for their physical flaws. Researchers at Family Doctors say that underweight boys are more likely to suffer from depression than overweight girls. However, they are often overlooked. Furthermore, society's perception of masculinity have worsened the abuse of steroids. Fraser writes, masculinity is any way that attempts to delineate people into social hierarchies. Individuals who are more masculine typically tend to describe themselves as more sensitive to how their behaviors affect their social rank or reputation. They also tend to desire to feel like they are improving in some tangible way, such as bodybuilding. This masculinity in society leads to toxic masculinity, which can be described as the extreme by which an individual's pursuits of becoming better represent a threat to oneself or others. Not only can this masculinity in the community be the defining factor of how they are perceived in the community, but it's also a way for them to feel comfortable within their position in the hierarchy, therefore using anabolic steroids to improve this said position. The use of anabolic steroids can also come from external pressures. A study was done at the University of California that states human beings are genetically programmed to have more value within winning within a group than rather individually. Peer pressure is so influential that between 1998 and 2003, the percentage of 12th graders who found that steroids were risky dropped from 68 to 55%, despite increased health warnings. Pressure can also come from parents as well. Teen Saver says that parental pressure in a form of negative comments and a focus on physical attributes is also correlated with the motivation to take steroids and to build muscle in adolescence. Parental guidance and opinions have a large effect on their children, therefore leading to an easy transition over to the use of anabolic steroids if their parents deem it necessary. This is Abby's futuristic lens now.
Our future is heavily impacted by the use of anabolic steroids, including societal implications, mental health effects, and addiction risk. Even after increased usage, the proliferation of steroids is unsafe and will set unrealistic body standards. Steroid use perpetuates unrealistic body ideals, leading to societal pressures and body dysmorphias. Young teens may feel pressured to use anabolic steroids due to insecurity, which creates unrealistic body standards. Furthermore, its use in teens and adolescents has significantly increased and will continue to harm the health of future generations. People who use steroids often report mood changes, increased aggression, violent or irrational behavior, depression, overcompetitiveness, and addiction. Individuals who take steroids in high amounts are at increased risk for steroid-induced psychosis, which will result in permanent mental health effects. Permanent psychological effects that includes persistent mood disturbances. A study conducted in Saudi Arabia found that out of 3,183 patients, the most common psychiatric disorder was anxiety at 0.9%, followed by psychological and sexual dysfunction at 0.76%, and depressive episodes at 0.7%. Now for dependence. The side effects of anabolic steroids are prevalent and problematic, and symptoms can range from mild to severe. Dependency of AAS is highly likely. First, for physical dependence. Physical dependence on steroids can develop due to their impact on the body's hormone levels. This reliance can lead to withdrawal symptoms and cravings when attempting to discontinue use. Next, psychological dependence. Psychological dependence on steroid can develop as users become emotionally reliant on the drugs to boost their self-esteem and self-image. This dependence may result in cravings and difficulty ceasing use despite awareness of the associated risks. Lastly, for long-term consequences. Long-term steroid use can lead to detrimental effects, including cardiovascular issues, liver damage, and hormonal imbalances as stated in the scientific lens. A quote from the Harvard Gazette states, anabolic steroids clearly do cause an actual biological dependence syndrome, and men who develop a dependence on them have considerable difficulty getting off the drugs, just like people with other forms of drug dependence. This quote emphasizes the current abusers struggled with AAS and is seen similarly in other forms of drugs. For our counter-argument, we found a new drug called nandrolone and oxandrolone, and these are prescribed to young kids who have stunted growth, other forms of like inflammation or other medical causes that can be described by a pediatrician or like medical professional, and this can help with the symptoms.
Researchers are attempting to find a way to intervene with severe drug use among teens. 56 adolescent football players in an urban high school participated in a study by Lynn Goldberg and her fellow researchers who worked at Oregon Health and Science University. The teens attended 8 weekly, 1-hour classroom sessions led by coaches and adolescent team leaders. They also attended 8 weight room sessions delivered by research staff. The intervention addressed sports nutrition and strength training as alternatives to steroid use. They also did drug refusal roleplay and anti-steroid media campaigns. The players were significantly less interested in trying steroids after this intervention, were less likely to want to use them even if their friends did, less likely to believe that steroid use was a good idea, believed that steroids were dangerous, and had a better knowledge of alternatives to steroid use. Overall, researchers found that educating and introducing new and alternative habits to steroid use will lower the interest in steroid among teens. Thank you.
Elliot, give one specific way that your thinking changed as a result of learning about Abby's findings.
Abby shared the long-term effects of steroids mentally and provided examples that I wasn't aware of, such as like violent behavior, irrational behavior, and mood swings. This changed my thinking because I now understand that not only physical lasting effects, there's physical lasting effects, but also mental ones. When you think of steroids, you only think of physical effects and what it can do for the body, but you never really think of the mental, especially that they are long-term. So thinking about how there are violent behaviors for people who are using them long-term, and it can last throughout life and affect how their life is in the future, makes it really seem that steroids is not the best alternative for muscle building and to improve someone's self-esteem.
Okay, thanks, Elliot. Abby, reflecting on your colleagues' work, which one had the greatest impact on your overall understanding of the problem that your group worked with?
Personally, I feel like Elliot's work kind of on toxic masculinity really formed my opinion on this problem, just because I feel like it is so incredibly prevalent in today's society, especially with the use of social media, and just the use of anabolic steroids is becoming more prevalent in our society, and it's kind of creating this unrealistic body standard that I guess younger generations look up to, and it's not healthy and it's unsafe, and it'll only harm the health of our future generations.
Okay, thanks. Bridget, if you had another team member, what other perspectives or limitation could they have researched that would have made a useful contribution to your project?
I would say a useful lens that we could probably use would be environmental, because I personally don't know the effects of steroids that it has on the environment at all, if it does have any. And I think that researching that and finding maybe a counter argument or even more of a negative side effect of steroids on the planet would be helpful towards our argument.
Okay, thank you. Another round of applause.